Our topic now brings us to paraneoplastic syndromes and the different terms in which you would expect to see certain syndromes and the associated cancer. Our first paraneoplastic syndrome will be acanthosis nigricans. Acanthosis nigricans means thickening of the keratinocyte, giving it thus a dark color. You might find this underneath the armpit or maybe the back of the neck, and you should be thinking about maybe pancreatic or gastric adenocarcinoma. A topic here, this patient, hey doc, wake up in the morning and I feel a little tired. Takes me a while to get going. 5 to 6 o'clock in the evening, I feel great. I wish my workday actually started at 5 p.m. In this patient, as the day wears on, he or she gets stronger, not myasthenia gravis, the opposite. This is Eaton Lambert myasthenic syndrome. Associations: small cell lung cancer. With small cell, we will take a look at 3 different associations. This is one of them. So what is Eaton Lambert and what does it do? If you remember correctly from your immunology, that you would have your immunoglobulin and autoantibodies that are then attacking instead of acetylcholine receptors. They are attacking the calcium channels. Now I need you to picture this. Picture neuromuscular junction. Are you picturing it? Neuromuscular junction. Normally, you would release water from the presynaptic terminal, acetylcholine. What does it then bind to the postsynaptic terminal? Acetylcholine receptors. No problem there. What caused the fusion of your vesicle to the membrane in the presynaptic terminal? A trigger would be voltage-gated calcium channel. Voltage-gated calcium channels, these are the channels that are then being attacked by autoantibodies. So if the voltage-gated calcium channels are dead, the patient wakes up in the morning, doesn't feel that great. But how are your patient getting better? How is your patient getting stronger? The body will find a way. The body will find a way in which it releases acetylcholine from the neuromuscular junction or from the presynaptic terminal. You have any problem with your receptors in Eaton Lambert, so therefore your patient is then going to present it with. Well, you will have your end plate potential, then have action potential, and then it goes to the T-tubules, skeletal muscles, and the contraction. Right. Small cell lung cancers, paraneoplastic syndrome, hypertrophic osteopathy. What does it look like? Take a look at the fingers here. Those fingers are clapped. It looks like it's clapped, but this is the bone underneath the nail that is undergoing hypertrophy. your differential bronchiogenic carcinoma, hypertrophy, osteoporosis. Why? We don't know exactly. Then you have NBTE, stands for non-bacterial thrombotic endocarditis. And for this, you should be thinking about mucus secreting cancers, and these include examples such as pancreatic and colorectal cancer. Where are you, by the way? Endocarditis, most likely on the valves of your heart. Non-bacterial, sterile. Think about where you are and know it is interesting association. Seborrheic keratosis. The picture here on the right that you are seeing. The first picture will be that of your lesser chelate sign. This to you should also indicate adenocarcinoma, and usually it will be the diffuse type in which the E criteria will be negative. Another name for lesser chelate is called seborrheic keratosis, and on your boards, do not confuse this with good actinic keratosis. One has nothing to do with the other. Here we have superficial migratory thrombophlebitis. This is your pancreatic cancer. Then when we talk about GI and pancreatic cancer, I will then talk to you about this, and we will refer to it as being as Churchill syndrome, not Churchill sign. Churchill sign. Yes, you have learned correctly that yours, let's say tapping of the facial nerve, shoulder stack, or maybe carpopedal spasms with a bacterial cough. This is tonsil sign, hypocalcemia. Now, the picture on the far right is the ducting of the skin underneath the armpit that is acanthosis nigra. Nigra means duck.